Are you sitting down? And do you deal with sciatic nerve pain? If so, this video is for you. We're going to be going over 3 different stretches and exercises that you can do from the comfort of your chair. Hi, I'm Dr. Daniel Bridge. I'm a chiropractor here in Helena, Montana. And this channel is dedicated to teaching you tips and strategies to help you with your spinal health and to lead a pain-free life. Sciatica can be so painful and so debilitating. Luckily, there's a lot of really good stretches and exercises that people have developed to help with that pain and to help this condition heal. The problem is most of those involve getting down on the ground or getting down on a flat table, maybe on your bed. Great exercises, but you might not feel good enough to get down on the ground, and you might be worried about getting back up. You might be at work and there's no space to do that, or at a friend's house. So what we're going to go over today is 3 stretches and exercises that you can do from a chair that can really help this condition to heal. So the first one is called, hey, back up, kid. What you're going to do is you're going to sit at a chair and you're going to have a 90-degree angle in your lower back, a 90-degree angle in your knee, and you're going to take the affected leg, let's say it's my right leg where I'm having the pain, and straighten that leg out and point that toe up. So imagine that you have some neighbors over that you don't know very well, and they've got a 2-year-old kid and his hands are really disgusting, and they're not watching him, and he's coming up to you and he's going to get his hands on your new pants. What you do is you stick that leg out. Hey, back up, kid. Now, maybe he falls over and it makes you laugh. So as you do that, you lean your head back and you have a good belly laugh. Ah ha ha ha. Okay? Then maybe the neighbor sees you and you feel bad about yourself, so you put your foot down and you hang your head in shame. That right there is, hey, back up, kid, or what some people call the sciatic nerve floss from a seated position. Of course, I don't like kicking kids, but it's a good way to help you remember the exercise. Now, with this exercise and the other exercises I'm going to be showing you, there's a concept that we really pay a lot of attention to, and that is centralization. What that means is when you're having sciatica, that pain is going down into your leg typically. Centralization means that we want that pain to move up your leg and towards your spine as you progress through these exercises. So for example, if you do the exercise I just showed you, if before you started the pain was in the middle of your calf, and then after a few repetitions the pain has climbed to maybe mid-thigh or into the buttock area, you'll know that that's a good exercise for you. If the reverse is true, it starts in your mid-thigh and after a few repetitions it's down to your ankle. You really want to discontinue that because that's headed in the wrong direction. That's not the exercise for you. Centralization is always very, very important. Now, with that exercise that we just went over, what you're doing as you bring your head back and you straighten out that leg, you are tractioning the nerve down towards your foot. And then as you tuck your chin and you bend your knee, you're actually tractioning that nerve up towards your head. So that's why they call it a nerve floss or a nerve glide, because just like a piece of dental floss sliding back and forth, you can actually glide that nerve down towards your foot and then back up towards your head all along the track. And that's just a really effective way at treating this sciatica condition. This next seated exercise I wanted to show you is a variation of something called a low back MCKENZIE extension exercise, which involves putting the low back, the lumbar spine, into extension. That's something very effective for treating disc conditions. You'll need a towel. I have, normally I would use a longer towel, a normal size towel. This is a hand towel. But it's kind of cool, and I would recommend using it if you want to look like a giant using just a normal sized towel. And it actually works just fine. So put it in the small of your back, and what you're going to do is lock that lower vertebrae in place, and you're going to lean back, which is going to allow the upper vertebrae to move backwards in comparison to the one below it. I'm blocking that vertebrae. I'm leaning backwards, and I'm going to hold it for anywhere from 10, 20, 30 seconds. And I come back, and then I move the towel up a level. I lock that towel into place, and I lean back. I'll go up another level. I lean back. What I'm looking for is centralization, as we talked about, but also you might find one level feels better than another level. When you find that, that's really the one that you want to focus on. Not only can it help that pain come out of your leg, but it also can help to decrease that pain that you might be feeling in your lower back. As we're discussing sciatica, true sciatica is typically one of the discs between your vertebrae and your lower back, typically that L4, L5 disc, or that L5, S1 disc that is bulging or herniating out, and it's putting pressure on that nerve, and that's what's causing that pain to go down the back of your leg. Now there's also something called piriformis syndrome that really mimics the pain of sciatica. It's still irritating that sciatic nerve, but what it is, it's one of the muscles here in the back. It's a hip muscle that connects to your leg. It's one of those muscles that actually turns your foot out, and it's a very problematic area. Many of my patients have very tight, very sore piriformis muscles. When I'm palpating around and I put my thumb on that muscle, they move, they feel it, it hurts, it's very tender. And it can mimic that sciatica because when that's irritating, when that piriformis muscle gets too tight, it irritates that sciatic nerve and you can still get pain going down the back of your leg. Now, soon enough, I'm going to make a video that really distinguishes the difference between piriformis syndrome and sciatica. But for now, what I'm going to do is I'm going to show you a really easy exercise that you can do from a seated position that can really help with that pain going down the leg caused by piriformis syndrome. So once again, what you're going to do is you're going to sit. You don't have to be in a chair, but in a nice seated position, low back at a 90-degree angle, knees at a 90-degree angle. And if I'm having pain down that left leg and I'm having that tightness here in this left hip, I'm going to take my left leg and I'm going to cross my ankle over my knee just like so. And then what I'm going to do is, keeping my lower back straight, I'm going to lean forward until I can feel that stretch right down there in the hip. For me, I don't have to lean very far forward because I have fairly tight hip muscles, but I instantly feel a really good stretch down there. That's one that you'll want to do on both sides to have good balance. It's one of those things that hurts so good. It's kind of tender, but it feels good. And then once you're done, oftentimes you can instantly have a decrease in pain and you can feel a lot more looseness there in the hips. I'm sure as you're learning, taking care of sciatica is not a one-size-fits-all approach. You might need to try some of these different exercises and find out what works best for you. And you might just find that seated stretches and exercises are a lot more beneficial for you. Let me know what you think. Also, as you know, I mentioned L4, L5 disc bulges. If you want to learn more about those, how they happen, how to take care of them, how to avoid them, you can watch this video right here. Thanks for watching. Subscribe to our channel so you don't miss any strategies or tips. Please like this video and share it with your friends.